We're going. Oh, thank you. Have a seat. I'll give you a second. Good to see everybody. I know lots of you. Again, I'm Danny Blanchflower. I'm Professor of Economics. Lots of my students are here. I've been at Dartmouth for 38 years, so I've been here kind of a long time. And I want to talk about the basis of this conference and, in a sense, how it came about and the people who kind of caused it all to happen. And so I want to start out, and John's talk this morning was inspirational, and Jean's gonna follow from me, and these are the great people. And Jean was just saying to me a minute ago, what did everyone do? What did we all do? It wasn't like it was, it was, what did we do? I used to write about what I call the economics of walking about, and Jean just said what we did was we walked around and we looked at the world and we spotted things, and that's what we're going to talk about. Alex and I have been writing, my co-author over there, and we spotted things, but we hadn't really spotted it until Jean told us. So anyway, I'm going to tell you where we are. So the background to this is that everybody was told, and I was told, that the most happy time in your life is when you're young. Wrong. Used to be true, that's not true anymore. And what I'm going to start out with is, in a sense, where we're going to end up, is a chart there which is to do with despair. And despair here is defined, and it uses a major set of data in the United States. We have millions of data points in it. And it simply asks this question, over the last 30 days, how many of those days were bad mental health days? And in the past, about 2 or 3% of people said the answer to that was 30. And so here's the plot today. This is literally in the US today, of the proportion of people who say, every day of my life is a bad mental health day. And as you see, it slopes down in age. Ill-being declines in age. Well-being rises in age. And I didn't know that 2 years ago. And I had written endless things on it, and Jean had actually spotted it before me. So we're going to hear stories that this young man down the front's involved in this story too. So let's go on. I mean, so eventually we've written, I've just put this here because people can download the speech. These are papers that basically he commissioned us to write. And we've written for the UN as the background to this, and Josephine too. These are all sorts of papers about the world. And so I'm going to talk about the United States to start with, and then we're going to talk about the world. And actually my student is over there. The red chart that John used this morning about the world, he did. He called me up and said, how did he do it? I said, I don't know, but just tell him and you can have it. So good job. Anyway, so these are papers that we've written, and we're going to talk more about this. So papers on Africa, Latin America, Middle East, Asia, and around the world. And basically, these papers show this phenomenon has basically existed everywhere, exists everywhere, but didn't, and it's only rapidly changed. I want people to have in the back of their heads just 4 facts, and 4 facts seem to set this up. The first is, started in 2015, and I sent the slide to Jean, and Jean said to me, actually, Danny, it's 2012. So I think the only thing between us, in fact, when we're talking, is it 2012 or 2015? So we're somewhere in between. Let's go 2013 and a half, right? We'll agree to that. Okay. It applies disproportionately to the young and women in particular. And it doesn't appear to be about being prepared to talk about it, because if it was that, well, why wouldn't 35-year-olds and 45-year-olds and 55-year-olds not be prepared to? It's global, and it's getting worse. And that's the story you heard from John this morning. And essentially, I have in my head that there's a pool of people aged 12 to 24, and next year there's going to be a new group of 12-year-olds coming in, and the 24-year-olds become 25-year-olds, and we need to do something about it. I want to talk a little bit about how I got here. And some of it, I mean, this is just, again, for people to think about, but a big part of my story is I've worked on happiness for quite a long time. Part of the reason I was interested in happiness, I was a person who was interested in wages. And there were patterns in the wage data. If you look at wages in Botswana or wages in France, there were patterns in the data. So I could write about that. It turns out that I was attracted to this kind of stuff years ago because I found that there were patterns in the data. A couple of things you saw in it. The first one was unemployment always enters negatively in a happiness equation. Unemployed people are less happy. Marx's reserve army of the unemployed is a conscript army, not a volunteer army. But there was another thing in the data which was actually incredibly important, and that was the thing at the bottom here, was that for 20 years I wrote endless papers saying that happiness was U-shaped in age and hump-shaped in ill-being. And I'll show you the picture and I'll talk about it in a minute. We got very focused on this thing, which was the hump shape in age or the U shape in happiness, particularly through work by Case and Deaton, who were interested in deaths of despair. And mortality and morbidity tracked each other. And so you had the least happy people, the people in midlife, and they had deaths of despair. And they had suicide and overdose, deaths from overdose, and deaths from cirrhosis of the liver, and so on. So that kind of focused people's minds, and I wrote all sorts of papers about this, and COVID came along, and I was still convinced that that was the story. Just to give everyone a little bit of background on how we get to this. So this was what was in my head, and had been in my head for a really long time. So you could plot this story. Remember, you don't have to remember it because it's gone, but this is how it was, right? So this is a major survey done in Europe, and many of these surveys around the world, and Jean's looked at lots of them, Pedro's looked at lots of them. This is a survey of happiness, life satisfaction. They just ask you, how happy are you? And it turns out these are pretty well correlated with stuff. Well, what you get is, look, this is age along the bottom, how happy you are on this other on the vertical axis, and young people are especially happy, and the happiness declines in age to a minimum around 50 or so, and then it rises, and there's all sorts of things about what happens later, and there's all sorts of papers which say after the age of 65 there's a mortality selection bias, happy people live longer, and that's where the literature went. It also generates another literature. So there's a U shape in happiness, and then you can flip it. And instead of having a U shape in happiness, you have a hump shape in unhappiness. And that's deaths of despair. That's the story of the story that they have of that. And that's the question that I showed you. Now thinking about your mental health, which includes stress, depression, and problems with emotions, for how many days during the past 30 was your mental health not good? And we have data for the US from 1993, and every year from 1993 through around, 2013 and a half, you got that pattern. So there's a fella down there who's Doug Stager's in the front here, and I wrote this. And I suddenly realized I had to give this talk because I wrote this. And I wrote the following: the overwhelming evidence supports the conclusion that there's a midlife low in well-being. This is among the most striking, persistent, and consistent patterns in social science. What idiot wrote that? Oh, it was me. Okay, so the thing about it was, I said to Doug, oh, God's sake, I got to write this. I've got to write the Blanchflower's an idiot paper before somebody else does, because until it wasn't. So anyway, so I wrote a paper and I did a summary of it. There were 650 published papers, mostly in refereed journals around the world, talking about that. So Steger's in the next office to me, and he's going to talk a little later with his pal Tom Kane, and Jean's also going to talk about the effects of all this on test scores. But Doug said to me, go and read. This is literally how this conference came. This is literally how the sort of literature emerged. Doug said to me, have you read this interview that the lady over there did? He said this is May the 19th, 2023. So until that day, I didn't know this. So this is called Gulp OG. So around 2000, this is what she said in the interview. And I went, oh my God. Anyway, so around 2012, more and more teens started to say they felt lonely and left out. And more started to say they felt like they couldn't do anything right or they didn't enjoy life. Those last two are classic symptoms of depression. Then other data started to pop up. She's a data hound. I love data hounds. Clinical level depression that requires treatment started to rise. Emergency room admissions for self-harm started to rise in CDC data. Same thing for suicide attempts and completed suicides. And I went, really? So I went home. Oops. Turns out Jean was right. And it turns out that from around the dates we talked about, the well-being of the young had collapsed. And so Alex and I went away and we wrote a paper that's just come out in +1 with Zhao Zhu. And it's basically about the fact that what I'm going to show you, that the well-being of the young collapsed. And I wrote this paper, and I get a call from the fella down here, from the United Nations. And he said, well, Danny, you've written this paper on the US and the UK. Does it apply anywhere else? And I said, well, give me some money and I'll go find out. So off I went, as an academic is. Give us some dosh and off we'll go. So anyway, off we went. And he said, well, maybe we could think about a conference, whatever. So anyway, so the part of this story, so we've been thinking about that, writing these things, and Doug and I, this is literally the Steger Blanchflower show. So Doug and I go to the Green for her memorial, her inaugural lecture. This is true, to her inaugural lecture, September the 22nd. And she said this, my proposal, we approach this work systematically through key areas of focus. 2 of these areas are aimed at cultivating a campus full of healthy minds and brave souls eager to reap the benefit of the full diversity of our community. This is imperative. We know that anxiety and depression, stress and depression, particularly among young people, are at an all-time high, having been exacerbated by the global pandemic. And I went, yes! Right? And then you read the next bit, which said, fortunately, understanding how anxiety and stress play out in the brain and body have been the focus of my research for the past 20 years. What I've learned is that there are discrete steps we can take to better care for ourselves and others, and well-being is directly linked to academic achievement. And I went, she's one of ours. So and then she finishes with the single greatest service we can do for our students, our faculty, and our staff is to support them on our wellness journeys, and obviously for the world. So eventually, us two made an appointment, we went to see CNNC and said, I'm for this. And hence this conference was born, the money came, and here's where we are. But that literally is the story. It sort of starts on the Green. We look at this picture and we say, oh my God. So anyway, I want to just welcome everybody here, because this is where it all came from. Bob Putnam's here and all sorts of others are here, and we're pleased to have them all. So can I just show you what happened? So this is just the simple way he drew this graph too. This is just a simple way of seeing what happened. And I think it sort of sets John's talk this morning really in pretty good focus. I mean, Jean and John worked on these young folks, and obviously I'm an economist, I have a slightly different view of things, and I'm trying to think about the effects in the economy and so on. But here was the picture that if you just take the data, and I have data every year from 1993, but here's just the picture, and let me show you what happened. So this is the picture that I'd had in my head for 30 years. And then in 2013, 15, it starts to do that. And then it does that. And then it does that. And then it does that. I mean, this is, I'll go back, just do it one more time. So this is literally, this is a fundamental thing in society. Things don't change like this. Things do not change like this. I mean, there have been examples, and I was hoping that John Barry would come, and we could talk a little bit about what we learned from the great influenza, because the great influenza, it turned out, disproportionately impacted the young, and there are stories there, but unfortunately we couldn't get them to come. But here's the story. So not only did this suddenly the story I started to see, I went and looked, and the data started to show it's 2016 to 18, and that was the stuff that Jean had done. I started to see that, and then every year since, the thing has picked up. So now to have in your heads the picture I showed you at the beginning, there is no longer a hump shape in age. Unhappiness declines in age, right? That's the story. Unhappiness declines in age, and if I draw you a picture of happiness, it rises in age. And clearly this is a huge phenomenon. Pedro and I, we sat and looked at these pictures and we went, oh my God, what are we going to do? And that's really where we are, and there's lots of stories about where we are, and John's talked about this morning in an inspirational talk, in a sense about obvious things to do. This is not technical blinding science, it's in the data. But let me talk more about this and obviously these insights. But that to me is the story I'm trying to tell you. It starts in 2015. It turns out it disproportionately impacts the young. Here's a really important picture and story for you. Look over to the right. So if I draw a line up from about 50, and you can see all those other lines, while the line for the young is going, nothing's happening to the people over the age of 50. Basically, they're on a flat line. Nothing's changed. So this is a phenomenon that only impacts, in the last decade, people under the age of 35 or so. So let's kind of try and keep going. So that's where we are. That's the picture I started with, and that's where we are. And obviously the story I want to think about is, well, what the heck is going on, and what are we going to do about it, and where does it apply to? So the first thing we actually managed to show was that we have data, very similar data this is for the UK. So our very first step was to say, well, is this just an American phenomenon? And I was talking to the Surgeons General this morning, and I said to all of them, what you said was really important. But actually, it's much more important than in the sense you realized, because it's not just an American story. And we have everybody here from all around the world. This is not just an American story. And so this is the picture for the UK. This is just a grad student of Alex's. And this shows you exactly the same pattern everybody sees. Here's the picture. And the left-hand side of the picture rises upwards. And the right-hand side remains more or less flat. So here we are. This is the picture that we have, the story that we have, and there's a number of ways of doing it. It'll be a little more focused here. It turns out that the story here particularly relates to young women, and that John referred to that this morning. So there's two bits to this phenomenon. It's disproportionately rises for the young. It's disproportionately rises for women. It's also disproportionately rises for whites. Well, the other group is natives. So whites and natives disproportionately it applies to. It doesn't seem to apply in any way like this to African Americans, Hispanics, or Asians, especially not Asians. So this is a white phenomena, particularly young whites. And this is just females aged less than 25. You see the column on the side there. White females, and white females no college. So by 2024, young white females without college, 1 in 8 of them, 1 in 8 says every day of my life is a bad mental health day. So obviously that's, how should we put this technically, scared us senseless. For technically minded folks, just so those who like looking at regressions, there's just something kind of interesting. This is just quite, you don't need to see anything here. This is about, we'll model despair, and we can do it for 1993 to 1999, 2000 to 2009, 2010 to 2015, 2016 to 2019, and in the first column, everything's negative. And then you get to the final period, everything's positive rather. Everything's positive, which means as age rises, despair rises. And then you get to the end, and suddenly the signs everything switches, completely switches. And so this has taken a while for people to sort of understand and address. So John talked a little bit this morning about there are doubters, and I actually haven't invited the doubters along. I decided that the phenomenon exists, and I'm not going to listen to the doubters, because what if they're wrong, and what if I'm wrong? If I'm wrong, well, what the heck? But if they're wrong, we're in trouble. So anyway, President of the American Economic Association in a presidential address said, there's nothing new here, it's a myth. The belief that increases in youth suicide mainly reflect deterioration in children's underlying mental health, it's a myth. There's no mental health crisis, it's a myth. Well, I don't buy that. And actually, it turns out that if you go and check out what she said for the United States, and Jean's written a lot on these things, every single major data set, so I've written about this, you go away and you say, well, maybe she's right, let's go look. And every single data set you get, doesn't matter how you measure it, how the thing's taken, anything to do with who collects it, anything. I mean, I can summarize 12 data sets instantly, all say the same thing and all say she's wrong. Go on. That's the way it is. Okay. So some of this story, so Jean and I have been thinking quite a lot about this, and it turns out that we've got a few problems here, and this relates to young people. And young people, again, the president said to me when I was in the middle of all this, she said to me, Danny, there was one thing to understand here. In these surveys, you've got to really worry about who shows up. And do young people show up to the surveys, and do they tell the truth? Because it turns out that, first of all, they don't answer their phones, and secondly, they don't make phone calls. And it turns out this becomes a really big deal. It also becomes a big deal, and it's cleaner to see if we ask people about unhappiness. And medical folks are much happier to do stuff about mental ill health. And they validate, so if I just went to the doctors, I went to the doctors the other day, sit in the doctor's surgery, and he hands you this thing. It's called the PHQ score. You sit there and you go, and you score it. And I said, so the score is, basically you can score from 0 to 30. So on purpose, I scored 0. None of these. And I said, so what do you do if you score some big number? And he says, well, if you're a score on 22, I'll immediately try and get you an appointment at the psychiatry department. And the first thing I'll do is I'll start you on Prozac. Right. That's the sort of, in those data, it turns out in those data, the PHQ score of the young has collapsed. And there's lots of other ones you could do, but that score, the one that Blanchy took, the doctor I talked to him and he said, we get Dartmouth students coming in and they do this score and they scored 22 and that's bad. Okay, it turns a little bit harder, it turns out, to look at things in life satisfaction. Medics are not that used to doing it. Life satisfaction things don't predict ill-being in the way that mental health things do. But anyway, so off we go. And now we're in the position where we can basically look at the world. And the world's come here. It's come here. The UN went to Bretton Woods to talk about the world with Keynes, and they came here to talk about this. And so we've done a lot of work, particularly for Pedro, trying to think about the world. And this great chart that he drew, this is basically, look at the little bits that aren't red. It turns out, basically, we don't really have any good data for. Some of them are very small, but we have it for 167 of the UN's 192 countries. And the ones we don't have it for are things like St. Helena and, basically, I don't know, maybe they do, but I haven't got enough data. I can't tell you one thing either way. But this is the story. And we're going to talk particularly about how you collect data, because it turns out to be an important story. This is, and we're going to have a session tomorrow, this is a great set of data, and it's going to be a real tool for many of us, because what obviously we're going to say to people, and the point of this symposium, is to try and think about things that work. Come up with treatments, can we come up with 15 treatments? Turns out that this Global Minds data set is fantastic, because it's you can use it everywhere, and we can think of it as you start with this, you do the treatment, and you see how the thing has changed. So this is about a data set called Global Minds, and this is a survey done around the world where people go online and they asked a set of questions. It's called the MHQ score. I've had many people here, many of my students have had to do this thing, and it has a great benefit that you do the study, and then it gives you a report. And it says, you scored very well, you're doing fine. You scored horribly, our advice to you is to see a mental health professional. So when you take these data, the patterns in the data are astonishing. In every country in the world we see, and it's been done since 2020, in every country in the world, basically, we see the young are less happy than everybody else. And in these kinds of surveys, it doesn't matter how you ask it. It doesn't matter whether it's about life satisfaction or happiness or anything. It's about their well-being. So Pedro and I have seen this, and the point of this is we're scared senseless. What do we do? And I was talking to Bob Putnam a minute ago, and all these folks are coming here to think about, Doug and Tom are going to work on the test scores. As this occurs, we see a big decline in test scores, and Tom's face dropped when I said to him this morning, so the big question for you guys is, all the people from the UN come to you and say, right, I'm from Bangladesh, how do I get my test scores up? And his answer to me was something like, well, in 6 months we might have a plan, right? It was something like, but it was at least the great thing is he's working on it, right? But you'll see, he's laughing, but it's true. That's what he said to me. All right, these are the world's experts, so, they're on it, right? So let's go on a sec. So then some of the story has to be, how close to home is this? Does this apply here? And obviously we've talked a lot to the president, and we've tried to think, and Bruce has been fantastic on this, and you saw the day he did yesterday and all the stuff about outdoor activities, and we're convinced that a lot of this is about this thing. Well, it's not a thing, but if it was a phone, pretend it's a phone, that it's the phone, and we can get people away from the phone. And we're going to hear a lot tomorrow, and we're going to hear from pediatricians and others about activities that we can get other people to do. And you saw the stuff that John said, which is if we can get people outside doing things. And Bruce has been fantastic in, let's try and get activities. Let's try and get people skiing. And yeah, you can come for nothing and we'll get 600 people skiing. And he didn't tell us that now we've got 600 pairs of skis we've got to put somewhere. And oh God, and I have the guy who cleans my hot tub, it turns out, is the Dartmouth fly fishing coach. And he said to me, it's really popular, there's me, and if I could find 600 pals like me, I'd be in business. Because everybody wants to sign up for fly fishing and there's him, right? But anyway, let's keep going. So what we saw at Dartmouth is that, so we did work here at Dartmouth, and what we find here are a number of things, but particularly we find that Dartmouth does pretty well compared to other elite institutions and other non-elite institutions, but it's still horrid. I mean, that's the way I would describe it. A quarter of Dartmouth students say 26% say they suffer from moderate to severe depression. 22, yes, and many suffer from severe anxiety. 10% of Dartmouth students say they've contemplated suicide. And we do see things, something quite interesting. It certainly appears here in our data that athletes particularly have decent mental health. And particularly, it doesn't matter if you're in the team or in intramural or you just kind of run yourself. It appears to us that that's because they go out and see other people. They talk to them, they share things with them, they go on a bus together, they go out to dinner together, and they have a coach and they talk with each other. The big story yesterday, and I was talking to a lot of people yesterday, Willow was fantastic, talking about Dartmouth Outing Club. And she and I sat and had a conversation and said, well, this is all very well, but what about the 10% of people who don't go to the outing club, who don't join these things? Those are the 10% we need to worry about. And Bruce has obviously thought a lot about that, but obviously the 10% of people who've thought about suicide are probably not the ones going to the outing club, but they're precisely the ones who should. So we're thinking about that. Let me keep going. So the one thing we've also done, and I'm going to go for 10 minutes or so, we've also thought about, and again, I think this is pretty interesting. We started to think, well, what are the potential consequences of this down the road? And obviously you don't know, you haven't seen anything quite like this, and that was why we were trying to think it, and Darren McMahon is going to talk more about history of things, and so is Graham Burnett, both historians. But the story here we thought to ourselves was, is there something comparable to this? Perhaps bullying is like this. Well, it turns out first data set I ever worked on was actually a data set in Britain called the NCDS. And it's the National Child Development Study, and it's every single person born in a week in 1958. And we followed them, well, we followed them till now, so they're 67 or something now. And I remembered that they had their parents, when they were 7 and 11, reported whether they were bullied or not. So this is not a self-report. It's not like I'm doing really badly and I was bullied when I was 7. In 1965, their mothers told us whether they'd been bullied or not. So now we can look, the first thing we can do is we can work out who was bullied. So we can run a who was bullied equation, and I can control for who was bullied later, right? So I work out who's bullied. Turns out on almost any variable that you look at 50 years later, the fact that you were bullied or not when you were 7 or 11 has really negative effects, enormously big negative effects on almost everything, including whether or not you're alive at 60. I mean, a big prediction effect, controlling for the characteristics of whether you were bullied or not. So that made us think, oh my goodness me, the potential here, and why in a sense the gene's doing these things here, we're all thinking about this, is the potential is that this could be horrible. The consequences of this could be horrible. So we are here trying to think about what to do, and and I've talked a little bit about it to folks. We've produced a set of Dartmouth principles. We're going to talk more about it, which is by the end of this thing, we're hoping to be able to think about going forward, what should we be doing? And we can think in maybe 2 or 3 years' time, have we made progress, what's going on? And we hope between now and then, we're not going to see increasing numbers of bad outcomes. One of the bad outcomes we've actually started to see, it turns out, is evidence of, I'll talk quickly about it in a second, but we started to see bad outcomes. We've started to see rise in suicide. We've started to see rise in mental health hospitalizations for self-harm. We've seen kids being hospitalized for anorexia. We've seen rise in type 2 diabetes, where kids are looking at the phone, they're not exercising, and they're not eating well. And we're going to talk a little bit tomorrow, and Tara's going to talk, Thea Garajan is going to talk about, she thinks that diets and eating and stuff is a big part of this. And even it's had an impact because of plastics in the brain. So that's one thing. The one thing I would say, we had a conversation this morning about marijuana and drug use, and I think Jean perhaps is going to talk a bit. Jean suggests, and the data suggests, that actually marijuana use is down, maybe it's not consistent with what they said. But the other thing, we have not to this point yet seen a rise in deaths from drug overdoses. And my concern is that that's something we might yet see, but we haven't, thank God, yet seen that. Let me just go on a minute, and I've got a few more things to say, particularly about what I call, so we've had that, particularly what I'm going to call social desirability bias. And it turns out that this is a really big deal when you survey the young. First of all, young people, as I said, tend not to respond to surveys. And for economists like us, this is a really big deal, not least that the quality of data from major national surveys has been impacted. The head of the BLS got fired the other day, in part because the reliability of these surveys has really been a big deal. In the US, there's a big deal. In the UK, country that I'm from, essentially, if the official labour market data has been withdrawn as essentially not telling you anything, but not least because the young renters and immigrants particularly don't respond to surveys. So we have a set of problems in identifying this problem, and I want to sort of explain it to you. And it appears that the surveys like Global Minds that actually ask people to tell us about how they're doing in private tell you the truth. Mayor Cohen's a colleague of mine said to me, Danny, there's stories about that in less developed countries particularly. You know, in Gaza, the interviewer comes up to you and says, do you support Hamas? Well, you say what you're supposed to say, and then there's a separate survey which asks you online, and you say something different. Turns out this is really intriguing for a social scientist, which we need to puzzle over. So it turns out that most of the evidence is much stronger when you ask people in private. Less good when you have interviewers. And many of the big surveys that you may have seen, so the Gallup World Poll asks people, interviewers show up. Many of these big surveys, the interviewer shows up. And the problem is, it turns out that you may not believe anything they say. Let me show you something which is pretty intriguing. So if I show you this slide. So this is, so we now have, so this is like, which do you believe? And I'm trying to help cut through the dross here. So this is a thing called the Global Flourishing Study. I don't like it, and I've just written a paper with Alex called Not Flourishing, but anyway, we'll go with this. So this has a set of countries where half the people who are interviewed, who are interviewed by an interviewer, and half the people do things online. We'll just make it simple, assume that there's no specific difference between them. And they're asked a series of questions, and they particularly ask questions about their well-being. And look what you see. So this is just this. So I'm trying to say, okay, what's the sign of the young here in this equation? So the negative up there under depressed says the young are less depressed than everybody else if they have an interviewer. But in the same country with the same question, and they're asked online, they're more depressed. And the same is true with any variable really about, particularly anything to do with your mental health. I mean, there's like a dozen of them. And in every single case, when the interviewer's there, you say things are fine. And online, you say things are not fine. So obviously, we have to deal with which of these do we believe. And it turns out that lots of work is going on this. I'm of the view that actually we believe what's on the internet stuff. Oh, and just so people can see, so when you ask questions about objective things, like how many cigarettes a day do you smoke, or how many drinks do you have, or are you in pain, or anything that's not about me, not about how I'm feeling, how I'm looking, there is no difference. So this is really intriguing, and it's true across all these sorts of data. So Jean and I particularly, we have to make judgments about which of these stories you believe. So if you read the World Happiness Report, and you look at the data from the Gallup World Poll, it basically says that none of this is true. Basically says that. But guess how they collect the data? All of it's collected by telephone. And as soon as we see, particularly in Europe, we see in Europe that same thing is true of the thing called the Eurobarometer. But there's a new set of surveys called the EU Loneliness Study, and Dr. Murthy would be really interested in it, and I sent it to to others to look at. And the EU Loneliness Survey is a survey, the first one they've done in the EU on the internet, and exactly the opposite is seen. You exactly get the young are in trouble. So obviously the issue here are young are in trouble, but it looks like they don't want to admit it. And so what do we do? And many of the researchers here you're going to hear from at Dartmouth. Dartmouth is the center of this. Lots of people here are working on this stuff. You're going to hear from pediatricians who actually say to me, I think this sets it up, and I was talking to the dean of the medical school just earlier, and we're going to do more on this. The pediatricians in the medical school tell me 10 years ago, 80% of the kids who showed up in their practice were there because of ear, nose, and throat. Now, there's some improvement, it turns out, because of medications on ear, nose, and throat stuff, but 80% of the kids who show up into their practice at the Dartmouth Hitchcock are there because of mental health issues. And we heard from the emergency room doctor at Dartmouth yesterday saying the same thing. So what do we do? And you heard John say it, and Jean's done some of this sort of stuff before. We've looked at my data on unhappiness. We see that there's objective evidence is consistent with rising youth ill-being, mental health hospitalizations. And I was just talking to the gentleman from Zimbabwe yesterday who was telling me that, and I hadn't seen very good data for Africa, and he was telling me that the story in Africa is exactly the same, and it's putting us in touch with people in Zimbabwe who've started to see exactly the same things. They're seeing upticks in taking of drugs and other things. But this is very new. This is coming, but this is, as I say, people that are here, we're talking to them, and we're going to talk and try and get in touch with John and so on, think about, well, what do we do in Zimbabwe, which we hadn't known till today. So other things, as I said to you, like type 2 diabetes is up. Joanna Leonard is talking tomorrow, and she has 2 great papers in JAMA talking about the rise in mental health hospitalizations. That's consistent with the internet responses. It's not consistent with the other ones. Antidepressant prescriptions are up. Suicides are up. I'll just show you some pictures. I mean, you saw that Janet Curry said suicides aren't up, but suicides are up. And in the UK, in Europe, we're starting to see this in Europe. And we've had a paper by a couple of folks in Australia, and Australia is now very upset and worried that suicide rates in Australia are up. And obviously, we've just got this new data come out of the European Commission, and I'm just giving you there for a number, but you see, this is 15 to 19-year-olds. This is global story. This is a story telling you that basically we have the same thing everywhere, which is why Pedro and everyone else is here. And obviously, we want to think about what to do about it. And in a sense, I want to put in people's minds that the idea of the principles we're coming to is a sort of extension of what the Surgeons General talked about. That's not an American story. It's not an American story, and I was talking to them about that before. I'm nearly there. So it turns out this is what Jean, I think, is going to talk more about, but it's sort of interesting. Can you look to see other things? What other things do we see that's going on that are consistent with and not consistent with the story you get from the surveys, which is a global problem? And it turns out, look at this. This is, and I heard there was something that Jean actually wrote that I read the other day in her book about 10 things to do. And she said, I looked at it first and I thought, this is weird. And she said, don't let people have a smartphone until they get a driver's license. I was like, oh, okay. So then I went and looked it up. And it turns out it's not only the reason you do that, it's for them to not get their smartphones till they're 16, it's for them to get a driver's license, right? It turns out there's a huge decline in the proportion of kids, 18-year-olds and 16-year-olds, who actually have driver's licenses. So anyway, so that's going on. But there's lots of other things that we need to talk about. And these are really Jean's things, but she's going to talk more about. I think this is really interesting. Decline in the proportion of kids who will do dangerous things. I don't mean, crazy things, but, dangerous things. Percent who are unhappy rise by hours per day on social media. There's a decline in the times per week teens go out with friends. And I was talking to Bob Putnam earlier, and I said the great thing about your book and Jean's is that you can look at the graphs. There's a nice graph, and you can look at the graphs. This is what it gives you. There's a decline in the time spent socializing. A rise in the percent of teens who've less than 7 hours a day of sleep. As I said, decline in the proportion of 12th graders with driving licenses. And the decline in the percent of 12th graders who think marriage, having a family, and having children are extremely important. So this is a societal change. This is a fundamental change that we see in the data, and we are seeing it increasingly across the world. And a couple more things I want to talk about, and then I'm going to stop. So here's a one that's actually really quite worrying in a way what I asked John about, and I'm going to stop in a sec. So it turns out that this problem we have is a problem for 8-year-olds and 10-year-olds. And we talked today about the panel talked particularly about, children. And it turns out this is really important, and we need to do something about our children now. But the problem, it turns out, and something I really hadn't thought of and I hadn't really understood, was that we should have listened to John 15 years ago or 10 years ago. So think about the kids who were 15 in 2015, and all this stuff was happening. So now they're 25. Well, it turns out in our data, we hadn't realized this, that the big rise in the ill-being of the young who are 23 and 24 and 25 is driven by a huge rise in the ill-being of young workers. And this is not something that we had seen. At the same time, there's a relative rise in their wage. So economists have gone and say, is it because they're paid less? Well, it turns out there's evidence that they're rising wage. So if you look here, let's just look at hopefully I can see the picture. So here is the despair levels of the young workers. So here we are over here, pretty flat. Well, as time goes on, now we start to move through time, and the typical 19-year-old worker, 3% of them were in despair down here, and now 9% of them are. So we don't understand that really. But around the world, we're starting to see evidence that work matters. But a big part of this story, and why I asked John this question, is what in goodness only's name do we do about the fact, and this is more than half of 23-year-olds are in work. And so then we go and say, is this true across other countries? We haven't done much work on that yet. We're starting to look at workers in other countries. This is all very new stuff. But as I say, the answer here is that it doesn't really apply. I mean, go back to this story again. Go back. It doesn't apply out here. So look, not really much. A 50-year-old worker, nothing much is going on out here. So part of the story has to be, we've got all these resources given to aging. I've tried to think of a new word, younging or something. Maybe we should be moving our resources to the young. I'm going to keep going for a couple of minutes and then stop. And so it turns out that young workers are a major problem. And when we try and validate that, and I always like the idea, I used to, as I say, call it the economics of walking about. Go and look at other data sources, go look at other places, go talk to other people, see what they say. And it turns out that there's a whole series now of companies who put out surveys of young workers, Pew and the Conference Board and so on, and they spot exactly what we've spotted. The well-being, the satisfaction levels of young professionals, young workers who are aged 24, in the US anyway, are in trouble. What to do about it, who knows? Obviously remembering that many of these kids who are 24 and 25 will drop off parents' health insurance when they hit 26. So obviously we're trying to think about why that might be. So anyway, I'm nearly done. And the more I kind of do this, the more depressed I get, I'm afraid. So why is the decline happening? Obvious candidates include access to the internet and the broadband. And Maurizio, where's Maurizio? Put your hand up. Where are you? He's here somewhere. There he is, my man over there. Maurizio has been great on this because John put up a slide about here's the story that I like with this. So with tobacco, what did the tobacco companies say? They said, oh, there's no correlation, there's no causation goes from smoking to lung cancer. So carry on smoking like there's no tomorrow, right? That's what they said. The causation is kind of, stupid. Of course, it was obviously completely wrong. Well, now you're in the position where we're having a similar kind of story. And I did note, I was going to say to Maurizio, what we do note is it's the same firms and the same law firms who are arguing the same thing. But let's keep going a second. So this question here is, where's the causality here? Where does causality run from? And Maurizio is going to talk tomorrow about it and has written some great stuff on it and talked about the fact that actually we now can see the causality here from a whole series of natural experiments run where, see if I've got it wrong, shout out, but I've read your paper carefully, so, that's why I invited you, so I read it really well. So what he's got is, this, you can look at the random spread of broadband. Broadband comes to various places, bit by bit, to area by area, and they track the well-being of the young and others as the spread of broadband comes, and guess what you find? As the broadband comes, particularly the well-being of young women particularly deteriorates. And we've got a really good set of ideas about and evidence that causality, we know the direction of causality. There are doubters to this. I didn't invite the doubters, I invited Maurizio. Because I believe him. Hey, so this is a really interesting and good story, and it looks that the spread of the broadband precedes the decline in the well-being of the young. And I think, as I say, we're not having a session saying he's wrong. He's going to tell us about why he's right, because I think he is. Anyway, we have a couple of other things just to say. There's a few little things going on as well we have to say. A couple of things. First is that some countries in the world, there's things going on in labor markets, and labor markets are pretty important, and John showed it this morning. The first pass in America is that the well-being of the young deteriorates during the period 2010 to 2020, over the time period in which the unemployment rate falls. So the sign's wrong. It doesn't get you, that doesn't get you any place much. We have a couple of counters, and this is relevant, and people, particularly from Central and Eastern Europe. One of the stories there is that there's a complicated story, but the countries from Eastern Europe, from the time when the wall came down, the well-being of people in the country generally, the GDP levels, living standards rose, and in those countries you'll see the well-being of everybody appears to rise, and there's some evidence that perhaps the rise is not as high amongst the young. But in a country that's transforming and doing better, we see some evidence that the young do better. But when we take the internet type surveys, there's some evidence that they don't do so well. A couple of other things that we've actually looked at is in fact this, and these are the backdrops. There are country level stories. So the other thing we spotted is that in Spain, Portugal, Greece and Italy, as a good labor economist, what we found was in 2015, youth unemployment rates were about 55%. And some countries around the world, that was true. So youth unemployment rates were 55%. And what's happened is the youth unemployment rates have fallen from about 55 to 20. And we see in those countries the young like it. So when you are in a country where the youth unemployment rate, so everyone else's was 25, yours was 55. Now everybody else is 20 and yours is 20. The young in those countries appear to like the fact that the labor market, relative to what it was in the past, is better. So we have some evidence for Eastern and Central Europe that the young probably doing okay. In Greece and in Spain, because the labor market's now doing better, some evidence that they do better. So I'm nearly done. Let's finish. Oh, the one chart, and then I'm going to, for Bob, I want to show him this chart. Here's the chart. He did this chart. So Bob is famous for talking about bowling alone and for having talked about the fact that people bowled together. So the young man over here did his thing for me, and we were looking at data on how many establishments there are in the country. And he found that actually the number of bowling alleys has collapsed. Hence, his section I called Not Bowling at All, because not only are they not bowling alone, they're not even bowling at all. And so that's some of the change. So I'm going to stop. Gene, you can, if you can come up, I'm just about done. If anyone wants a question. So the global evidence is that in 167 countries, it's collapsed. Happiness is not U-shaped anywhere anymore. The strongest evidence is in internet-based surveys. There's social desirability bias. But I want to finish with this. We need to rebuild social connections. We need to get kids playing again. Gene, as I said, even thinks we shouldn't get smartphones until kids get their driving licenses. And the more I thought about it, the more I liked it, because I hadn't realized they just hadn't got a driving license, right? So this might be a way of getting that. People are going to talk about stuff. Andrew Clark's going to talk tomorrow about what we learned from other campaigns like drunk driving and seatbelts and smoking, what we can do to change things. But here we are, over to Gene and John and Doug and Nick and Tom and Lisa and Andrew and Alex and Tara and Randy and Bruce and Pedro and Josephine and the Geisel Fox and the Surgeons General and Gene, because holy mackerel. Thank you. And then she's up.
Yeah. All right, fabulous.
Oh, thank you.
Absolutely. So I'm going to start with one detail and one little bit of a deeper dive. So the detail, did you notice that despair actually dropped between 2023 and 2024? Because I noticed that too.
I know,
and so I get questions about this. I have my own theory.
And 25, we've got a little bit of drop too.
Yeah, I don't think I have 25 data yet, but it is part of a bigger picture, just so to put that in context. So that survey shows that major depression in National Study of Drug Use and Health shows it, Monitor the Future starting to show it, that you get the peak around, it depends, but around 2021 and 2022, and then 2023, 2024, things do start to improve. So again, I have my own take. What's yours?
Well, just add to that. So Joanna Leonard, who's going to talk tomorrow, they have a paper on hospitalizations and admissions, and they see the same.
Okay.
That one thing they do see, I think I'm right, is it's only true for boys. So the hospitalization, it's hard really to know. I mean, maybe still there was a COVID effect, and maybe that effect is slowing off. But the story I should have said to everybody is that this is what Jean's written about, what John's written about, what I've written about. This is not a COVID story.
That's
but
right.
it might. You see, in a sense, there's two bits.
It's a little bit of
it's
a
a little
COVID
bit of
story.
Absolutely, absolutely. I mean, the story. Can I tell a little story about the students? So I found a little bit here. So going on, I mean, I taught these very good folks, and I taught them via Zoom, and I came back. And this has changed a bit. And I said to them, the thing I've been here for 30 odd years is that you don't say anything to each other. You don't speak in my class. You don't participate in the way that you used to. And one of them turned to me and said, because we don't know each other. And they've been here a little while now, and they're starting to know each other again. So I don't know. I think that's a really pretty telling thing. This group they were the group that were in COVID. They were the group that was online. You know, we shouldn't negate it. But I mean, the stuff we're going to talk about test scores, all of this stuff starts prior to COVID. COVID worsened it, but maybe there are lingering effects, and maybe that's just kind of wearing off. Is that your take? I mean, is that pretty much your take?
Yeah, that it was already there. Most of the change happened before COVID. COVID made it even worse. And then that COVID effect is resolving itself. That's my theory. Yeah,
I think that's probably right. Yeah, I agree with that. I mean, I was going to add something else, which I was going to get to actually ask you a question. I can ask it now rather than in a minute. The question that the doctors tell me, and the pediatricians have started to tell me, is that the kids are saying to them, it's not me, it's my parents. And maybe the role of the parents is changing a bit, but I'll give you a little story. In the talk here, I actually wrote a bit about conkers. You know what conkers are? It's great. It's in The Economist this week. It's a great story. So when I was it's this day of the year. It's like October the something. So when I was a kid in Britain, the horse chestnut trees were brought in, and they particularly expanded this because they wanted things for kids to do in the playground at playtime. So the horse chestnut trees, full of these things called conkers, and we'd go out as kids and we'd throw things up in the trees, and the conkers would come down, and we'd get a drill, and we'd drill into the thing, and we'd play conkers, right? You'd hold the conker and I'd hit it. Apparently, that doesn't happen anymore. Why? Because the parents won't let the kids go and play conkers. But it's the parents, and the story is that the kids want to go, but the parents are too afraid to let them go, because it was a beautiful natural thing to do on a damp Saturday in October, freebie. But anyway, so the stories I'm starting to hear is about the parents, and I've heard more and more, and you're going to hear tomorrow, more and more from the pediatricians, that the kids say, I would like to do X, I would like to do Y, but my mum won't let me. And I've heard the other day from pediatricians here talking about things like how I feed my baby. And they say, oh, I'm having trouble with my baby because I'm doing this thing, and all my friends tell me to feed the baby like this. And the pediatrician told me this last week, but your baby's choking. Maybe it's a good idea to change the diet. And she said, oh, but my friends would think that was a really bad thing. And the pediatrician said, but your child's choking, right? Anyway.
Yeah. So parents definitely played a role in the part of kids not having as much freedom in the real world. But parents are desperate to get their kids off phones and social media.
I agree with that too. So, I agree with that.
So I mean, obviously there does have to be some change on the parent side, absolutely. But and that started longer ago.
So how are we going to do it, Jim?
That started in the 90s. So then it's more, parents do not want their kids in their room all the time on their screens, yet they are. And so it does work together.
Well, but there are examples. I mean, as I say, Andrew's going to talk a bit tomorrow. I do think there are examples where we've changed social norms. I mean, obviously the seatbelt thing is one example.
Absolutely.
Drunk driving's another. And smoking another. I mean, there are things, there's things economists have done. I mean, one of the standard things, well, how do we get, we were talking a bit about this before, one of the steps we didn't want children to smoke. Well, okay, we can do all kinds of things and have all kinds of campaigns, but economists realized that if you raise the price of a cigarette, you put more and more taxes on a cigarette, this may not be good for your revenue, this may lower your revenue on the tax, but if the purpose of the tax is not to raise revenue, but to stop kids smoking, it works. Right? It works. So I think there are things that we have to think about, like changes in social mores. What do we do with the packet of cigarettes? We started to put health warnings on it. I mean, we are going to have to somehow or other.
And that's what Dr. Murthy suggested that we do with social media. And I think that's necessary but not sufficient. We need to have more regulation, and we'll get into that part.
But the problem is going to be, one of our trustees is Jake Tapper. And the board of trustees and I were having a conversation about what we do at Dartmouth. And we were having a conversation much as you said. And he said, there ain't no way under God's green earth that these companies are going to cooperate. Mm-hmm. I mean, in part because they're in lawsuits. Mm-hmm. So we are on our own in a way because they're going to stand tooth and nail and say, it's not us. I mean, I gave a talk on Freakonomics, actually, to people can listen to. Great program. I do the talk on Freakonomics. And at the end, they introduce someone who says, oh, this is all rubbish. Blanche is talking rubbish. And the guy says to him, well, who are you? And he says, I'm the chief economist at Meta. And they go, well, you would say that, wouldn't you?
Yes.
Sorry, can't.
Exactly.
Exactly.
Yeah. So I was thinking, as you presented the data on young workers, that we have the theory that one of the mechanisms is that their childhood and adolescence was stolen.
Yep.
By these technologies. But I'm curious about your thoughts about what their mindset is now. Well,
you're the expert on this, I know, in many ways. You're right.
We can have.
Absolutely.
And I don't think we have great data on it yet. I think it's something but it's very interesting to speculate about. Why is it that there's been this enormous reconsideration of work? Why are there TikToks talking about quiet quitting? Why is there the idea that if you get up and go to work and you have a 9-to-5 job, that doesn't mean you're a responsible citizen like it used to be. Absolutely. Now it means you're a sucker.
Now means you're a sucker. You're a sucker. I mean, the question I asked John was sort of related to that. Now you're a sucker and you compare yourself to others, and with this damn job, I'm never going to be like the people that I compare myself to.
Right.
So this gives me no hope. I mean, there's something I do go back to. I remember growing up in Britain, and people in Britain remember there was a whole bunch of issues about soccer hooligans, and everybody thought that soccer hooligans were, unemployed yobs. Well, so there was I was at Leicester, and the most famous guy there, a guy called Sid Holloway, and he went off and did this great study of football hooligans, and what did he find? They were all basically young workers who were, they needed money to be a hooligan, right? But they had jobs. They were, many of them in full-time jobs, but these jobs were not really going anywhere, and their view of, the view of the future was limited. But this, it's not just a subgroup here. I mean, this is like, if you take 23-year-olds, this is more than half of 23-year-olds who report themselves. But others aren't. I mean, so now you're starting to see an example. Now, Alex does lots of work on this. He's the editor of the big industrial relations journal, and you're starting to see it. May please Bob. You're starting to see attempts to be more community-based. You see evidence now for the first time, big change in the views of the young about unions. Right? So this is about
more saying it's important to help others.
More saying it's important to help others, important to help me. But you've written about this, and I have. It's about the decline in the work ethic, but we don't really know why that is. But more than anything, how do we change that? And it's, in a sense, another thing we should have said a little bit on, and I think it's really interesting. John said to me the other day, and this is quite interesting, he says the thing with all of this is it's sort of apolitical. in the sense that he said to me, think about in America what he talked about. Where are the phone bans? They're in red states and they're in blue states, and there's a potential here that we can do something in an apolitical way, but we don't know what to do, right? And it's not obviously anything to do with pay them more, because their relative pay has risen. I mean, you said you looked at that too.
Yeah, and the hate that you get, by the way, for saying that young people are doing really well economically is quite stunning. And I think that may go hand in hand with social media as well. Right,
but also they're doing quite well in work, but they're not doing quite well in other things. They're not dating. There's all sorts of things they're not doing, which you document very well. So, okay, they have a job, but the job is not fulfilling their lives. They're not having sex, right? I mean, you've written about that too. So I think it's an all-embracing thing, an all-around thing. But the reason to sit here is, I think that it broadened a bit. It's what to do about the young, but now we have to add to it. What do we do about young workers? And it's in a sense, it's young workers who didn't get John's treatment 10 years ago, right? It's the integral of those we should have helped and didn't, and it's many of these young folks here. And John's view, I think, in ours is too, that mostly, I mean, there are still people here that have problems, but the truth is that John's view is that most of the people here at Dartmouth and NYU and San Diego and so on, they probably weren't the ones, and we should say this quickly, they weren't the ones spending very long spells on the phone. And I think Maurizio's done things on it, and you have too. But the logic here, in a sense, is if you spend a great deal of time on the phone, say 4 or 5 hours a day, as Dr. Murphy was talking about, that means time is not there to do beneficial good things. Exactly. So you actually end up not doing good things. And it's the duration of time. It's the, you know, if you take up a hobby of, I don't know, rollerblading an hour a day, you can find an hour a day, but you can't find 4.5 hours a day. So I mean, the purpose of this and its ongoing nature will be, oh my God, what are we going to do? Pedro. Good. Shall we go over to you?
Sure.
Take a break for 5 minutes. We're swapping. Thank you.